Hello! So, there's been lots of exciting expansion and changes happening here at the office, and I'm really glad to have you watching again, and I want to give you some information that's very pertinent for current environmental circumstances. As you have seen outside, the temperature has risen. I think we had one day of summer so far. It's officially the end of July, and there has been one hot day. However, you know, when the temperature starts getting over about 65, 70, people do lose a lot of body moisture through perspiration and breathing and so on, and it's very easy to become dehydrated. So what I'd like to have you consider doing is looking at taking electrolytes on a regular basis if possible, especially when it's warm outside, 3-4 times a week minimally, I would suggest. And then when you're exercising, I would do it without question every time after exercising. Why should you do that? Basically, water is fine, and that's great, you're drinking water. And if you're not drinking water, well, you got to work on that, and coffee does not count. Water is funny. It has a specific odorless, tasteless, colorless appearance. And if it doesn't have any of those qualities, it's not really water. Which would be why municipal water, by some standards, would not be considered water. That's a joke. Don't take it personally. We usually recommend spring water, or, you know, at least filtered water. Anyway, so why would one need to use electrolytes? The water going into your body, when you ingest it, oftentimes just travels straight on through, unless you have material in the cell that will actually cause, you know, like there's an electrical, you know, function here where it pulls the fluid into the cell versus it passing by. If you wanted to look more into this, I could have you research, if you want, online what is known as the potassium and sodium balance of the body. And you have to have like a really good balance of those two for fluids to move in, do what they're supposed to, move out, etc. So when you have really good mineral content, trace minerals and, you know, sodium and potassium balance in place in the cell, when water comes through, it doesn't pass by the cell, it goes into the cell, and then the cell can use that, which is very important. There's a lot of odd symptoms that people experience when they have, you know, dehydration, and sometimes they think it's due to something else when it's not anything other than the fact that they're dehydrated. And not just because they're not drinking enough water, but because they're not getting enough electrolytes. There are organs that are related to this particular function, for instance the lungs. Interestingly enough, the spleen and the pancreas and the kidney systems, you have to have those organs working really well in order to fully use fluids in the body effectively. But regardless of any of that, when it gets warmer or you're exercising intensively and perspiring, you definitely want to be using electrolytes. Electrolytes that we recommend, you know, is not an endorsement of any company. I'm just telling you what we found out there that works the best for our patients. There's smart water that you can get, you know, tends to be okay. It doesn't quite have the electrolyte content that will really get things on track, but it can be helpful. There's also this material. It's an electrolyte mix that you can get from a Dr. Price. You can order it online, or we have it in the office. And then we also recommend what are known as homeopathic cell salts. So these are materials that are very gentle, and they go into the cell, and you take them. They're little white tablets, very easy to take, or whatever, good for kids or whatever. Anyway, any of these things would be about 25 times better than any Gatorade product on the market, or knockoff of Gatorade, or even the healthy versions of Gatorade, which are also just laden with all kinds of sweeteners and cause all kinds of problems. At least what we see with our patients is them causing problems. So anyway, something to look at, something to consider. It's definitely warmer outside. Let's have you using those electrolytes and drinking lots of water every day, at least half your weight in ounces. So if you weighed, say, 180 pounds, you'd want to be drinking 90 ounces of water. There's 12 ounces in a can of soda, so you look at a can of soda, you take that much water, and you multiply that times whatever, I guess that would be about 7 cans, 7.5 cans, and that would get you to to 90 ounces. Alright, so I'll give you some good guidelines. Please go online. There's material on the website that we have in the newsletter section, MilwaukeeACU.com. Go to the newsletter section. You can read more about electrolytes if you're interested. Is that on the website?
Mm-hmm.
Okay, so you could read about that. And then if you have any questions, feel free to email me, curry@milwaukeeacu.com. You can always call, and as usual, if there's any concerns or problems that you're having with any family members or friends, you want to see if there's anything we can do to help out, feel free to give a call as well. 414-332-8888 if you need any contact with us. Thanks. Great chatting. Talk to you soon.